Lawmakers will return there to Capitol Hill next week, and healthcare certainly to be in the spotlight. This after Affordable Care Act tax credits meant to reduce insurance costs expired as of yesterday, cementing higher prices for millions of Americans. The House is expected to hold a vote this month on extending those subsidies, but it's not clear whether anything could get through Congress on a whole. Meanwhile, cases of the flu continue to rise across the country, and health officials are warning that the peak is not likely to be reached until February. So according to the latest data from the Centers for Disease Control, 7.5 million people have been infected with the flu this season. About 81,000 have been hospitalized, and 3,100 have died. Officials say the spike in cases not unusual, but complicating matters is a new strain, which is impacting older people more. And even though the current flu vaccine is not designed specifically for this widespread strain, experts still say it offers the best protection against the most severe symptoms. Joining us now, physician and senior public health contributor for Forbes, Dr. Omer Awan. Dr. Awan, thank you so much for joining us this morning. Let's start with the flu, actually. We just had the CDC stats, and I'll just say anecdotally, it feels like most people I know have been clobbered by this. And it's like people are down for the count, week, 2 weeks before they really feel like themselves again. Give us your sense. What can people do, and does it include indeed taking the flu shot to try to stay healthy and avoid it's a pretty nasty strain?
Absolutely. Good morning, John. Well, first of all, getting the vaccine is absolutely critical. And as you said, this vaccine is not a perfect match against this new subclade K variant. That's the name of the new strain that's more severe. It's resulting in more severe symptoms. It's making people sick longer. The recovery is longer. But with that said, it does offer some protection. And some protection, of course, is better than no protection. So that's why it's still critical for you to get the vaccine. The vaccine, remember, isn't necessarily going to prevent you from getting the flu, but it will prevent you from having severe symptoms. It'll prevent you and certainly decrease your risk from getting really sick and certainly going to the hospital. So that's why it's critical that everyone 6 months of age and older gets the flu vaccine. Other things that you can absolutely do are washing your hands consistently, staying indoors or staying at home if you're sick, avoiding sick contacts, and just, taking the normal precautions that we always do, staying in bed when you're sick.
Yeah, and one of the reasons, the flu would just be one reason why someone might need to seek out a doctor, to seek out medical care. And yet, as we just noted, these ACA subsidies expired. We also see a spike in healthcare premiums. So talk to us just what it's like for your average American. What is it going to be like, unless Congress can step in with a fix? What's it going to be like for people as they seek the care they need?
Well, it's going to be devastating, John, because, the Affordable Care Act, remember, protected 24 million Americans. I mean, they got health care because of this. And now nearly 5 million Americans will not be able to afford health care going forward. And this protected so many people. And this also offered protections for those that had pre-existing conditions. Remember, people with, for example, kids that had type 1 diabetes, for example, could have been barred from getting health care 15 years ago. But because of the Affordable Care Act, these allowed people to get the care that they need. And now we'll have people that won't be able to go to the hospital, get the care they need. If there is an emergency, they may not be able to fill medications. I mean, healthcare has become exceedingly unaffordable for the average American. We're talking about the average American. And I'm afraid that things will get worse and people will stop getting treated for things that they really need.
On another subject, Dr. Awan, you have a new piece out for Forbes magazine on the health risks of alcohol consumption, as millions of Americans consider taking part in Dry January to kick off the new year. So what does the latest research suggest? Is taking a month off actually beneficial to our health?
Well, this is interesting because we've been accustomed thinking for decades that drinking alcohol in moderation is beneficial for health, particularly heart health. But recent research challenges those assumptions in a big way, because now there's a growing body of evidence that now suggests that drinking even small amounts of alcohol can result in harm. And that's what we're seeing. So there was a recent study done in a leading medical journal, the Journal of American Medical Association, that looked at alcohol intake, all types, small amount and large amounts. So what they found was regardless of the amount of intake, people had elevated risk of high blood pressure and heart disease going forward. So that included even people that took very small amounts of alcohol. And this has been supported with many different studies. So, for example, even other studies have shown that even small amounts of alcohol are linked to cancers like breast cancer. So that's certainly different than what we've been hearing, decades ago and even recently about what alcohol can do to people.
Yeah, and the public's clearly hearing this because alcohol sales are falling. OK, so drinking less alcohol is among the 5 easy ways that you're saying that people can improve their own health in the new year. What else is on that list?
So small, consistent steps can have a huge effect on your health. So other things that I think are just drinking water. Many of us don't drink enough water. Men should be drinking about 12 glasses of water a day, women about 9. And I certainly don't drink 12 glasses of water. So that's something that I need to do in the new year. And I hope that others will as well. Water is critical for, our, metabolism, digestion. And the more we drink, the better it will be. Drinking less alcohol, obviously, moving our bodies a little bit. And that doesn't have to be, going to the gym for 30 or 60 minutes, even doing yoga, for example, doing household chores, gardening. All these things can make a huge effect on our health. And then, of course, taking social media breaks, that's a big thing, particularly for mental health. Mental health is just as important as physical health. So we should negotiate our time with social media and, perhaps take some breaks here and there. And, of course, focusing in prioritizing preventive health. So that may mean getting vaccinated against the flu, as we talked about. If you're a child, getting vaccinated against measles, going to your annual healthcare checkup with your physician. All these things can prevent problems from occurring going forward with respect to your health.
Dr. Awan, let me back up for a second. And social media breaks sounds like a good idea to me, but is there actual evidence that that social media impacts your health that negatively, and what is that evidence?
Yes, so there's a big study, the UK Millennium Cohort study, that looked at millions of kids, millions of adolescents, and what they found was that the more time that one spent on social media, the higher the levels of stress, the higher the levels of anxiety, the higher the levels of depression. And people that spent less time on social media had much better health outcomes with respect to mental health. So, and this is why, the prior Surgeon General, Dr. Vivek Murthy, declared this epidemic of loneliness and cited social media as one of the inciting factors for loneliness and for, mental health issues in America. So the less time that we can spend on social media, the better. Social media, of course, is part of the fabric of our culture, of American culture. But oftentimes, if we can take social media breaks, perhaps at dinner or, before we go to bed, stopping and deplugging from social media, that can have a huge effect on our health going forward.
Yeah, hear to that. Physician and senior public health contributor for Forbes, Dr. Onur Ewan, thank you so much. His latest piece is available to read online. Samara.